Good Thursday morning, everyone. Welcome into the Morning Medical Update. Today is Veterans Day, November 11th, the day that we stop to honor those who have served and who are currently serving our country in the military. COVID, as we know, has impacted so many different groups hard and in so many different ways. Veterans are no different. A recent study found that the positivity rate for unvaccinated veterans stands at 25%. That number is high. Can that be changed? We're going to talk more about that. We'll also discuss whether COVID can cause PTSD in veterans. And we're going to check in with these two right there and learn how they lean on each other for support. That is Matt and his buddy Archie. So we're going to talk to them here in just a few moments. So get your questions sent into us via Facebook, YouTube, and also you can email those to the Medical News Network. There's links right there on your screen, so get those in. But first, Medical Director of Infection Prevention and Control, Dr. Dana Hawkinson, joins us with numbers from overnight. How are we looking?
Yeah, we're holding steady. Still with 16 active infections, 6 in the ICU and 1 on the ventilator. We have 21 additional patients meeting that recovery criteria. I would say, though, that we haven't had a death since the 7th, which is a very good thing. And Hayes has 7 active infections and 9 in that recovery period as well. But what I saw today at the Kansas City Star is that the overall 7-day average for the number of cases in the Kansas City metro area is starting to climb again, unfortunately. We hit a nadir of just under 200 about a week ago, 200 cases a day, but now we are starting to climb back up on that rolling 7-day average. So that's concerning.
All right, thank you for that. We may have questions, so let's get to any reporters on the line today. Okay, none on the line, so we want our community, of course, to get some of those questions coming in. We'll get to those here in just a few moments. We know that COVID, though, continues to affect people daily in some way or another. Veterans are a group that was hit hard in particular, and a new study shows that still many veterans are hesitant to get the vaccine. A study in the JAMA Network Open finds that 71% of veterans who used the VA had gotten 1 or both shots already, but 29% were still unvaccinated because they have fears of potential side effects or just the newness of the vaccine. So they still have many questions. So we want to turn to our guest today. Colonel Barry Browning is right here to my right. He is a senior administrator at adult psychiatry here at our health system. He is a veteran. Also a veteran is Dr. Nicole Yedlinski, a physician here at our health system as well. So welcome to you both, but most importantly, thank you for your service.
Thank you.
So glad to have you here both on Veterans Day. We're going to talk about a whole lot of good stuff, and we want you to educate us and what we need to know about our veterans here in our community. But Dr. Yedlinski, you were a major in the U.S. Army, so you sent me some of these beautiful pictures. So tell us a little bit about what's going on in some of these. Where are you? I want to hear a little bit about your experience serving our country.
Thank you so much. So this first picture, that was a while ago. I was out in the field. This was when I earned my expert field medical badge. Oh, this was, so I had twins when I was serving in the Army, and my spouse and I were dual military. So as you can imagine, that brought some challenges. This was at my promotion to major. You can see baby in each arm there. But this was a really proud moment.
I mean, like full on have your hands full.
That's a
for
tough
sure.
battlefield right there.
Yeah,
That
so
is
this
a battlefield.
that was us serving dual military down in Fort Polk, Louisiana, which is a pretty rural area. So that was a tough time. Yeah, this was early on. This was, I believe, at Fort Bragg, North Carolina, where I did my residency. My husband was a UH-60 pilot, so a helicopter pilot in the Army. Brought some challenges.
Oh, fantastic. Thank you for sharing those. Barry, Army Medical Service Corps that you were in, Deputy Chief of Staff of Medical Plans and Operations. You were in Iraq. Tell us a little bit about the photos we're seeing here.
Well, actually, that was in Iraq. That was my command photo at the time. And then that was I love this picture.
That's beautiful.
This was July 4th, 2010. That was standing on top of one of the bombed out palaces of Saddam Hussein.
Wow.
That was a fun day. And then that was in southern Iraq. Very sandy, very desolate out there.
Thank you for sharing those.
Sure.
What does Veterans Day mean? I always like to know from a veteran standpoint, what does Veterans Day mean to you as a veteran?
To me, it's just takes me back to memories, being able to serve for my country, but with also great people, like Dr. Ulinski, and I have friends all over the world now.
Yeah.
And I've met from all my deployments, it isn't just from the U.S. There are veterans from countries all over that we have served with, and even to this day, we stay in touch.
Doctor, what's that camaraderie like?
Yeah, I would agree. It's that opportunity to pause and reflect on my own service and the service of all of the people I've met over the years, as well as, like Barry said, from different countries all over.
And you two worked together before, correct?
We did.
Correct.
In civilian life.
In family medicine.
In family
In family medicine. All right.
And then we also work together with the Veteran Resource Group.
And we're going to talk more about that here in just a moment. And on that note, I want to bring in a couple other special guests this morning. Retired Marine Colonel Matt Bono, along with his dog Archie. We want to thank both of you for your service. You're joining us from the Veteran Community Project. So Matt, good morning to you. So glad you're with us. Just please tell us more about this organization and what it's doing for veterans in our community.
Yeah, sure, absolutely. Thanks, Jessica, and you're welcome. Come here, buddy. Sorry, Archie, get distracted a little bit. So, Veterans Community Project is a nonprofit based in Kansas City, but we're moving nationwide, and we're out to end veteran homelessness with the tiny houses that you see here in the village. But we also help any veteran in need through our outreach center that is at 8825 Troost Avenue. And we're having a big event there today. The VA's out giving shots. We've got all kinds of other veteran service organizations on campus with us today. So if you're in the Kansas City area, come on out to 8825 Troost.
Well, we're going to put some information up on our screen and tell all of our viewers how they can help out. Okay, so we've got to get to Archie. He's been hanging out there this morning. So tell us about your friend and how animals like Archie are helping veterans with what they're going through as far as PTSD.
Sure. I mean, who doesn't like a four-legged friend, right? They're loyal. They're great companions. Archie's about 13 months old, so he's still got a bit of a pup in him. And you see him, he's tracking birds. He just loves to watch birds. So he gets a little distracted, even though there's a camera here. But animals are so soothing. Not just to vets, but to everybody, I think. And one of the things that we do with our tiny houses, we're a pet-friendly village. What you have is you have a lot of homeless vets that have animals, and they can't go to typical homeless shelters with those animals. And so dogs, cats, we've even had turtles here in the village, all very important to helping vets.
And they live right there inside those tiny homes with the veterans, right?
Absolutely, absolutely.
Can we take a sneak peek inside one of those homes? I just think that is so fantastic.
Yeah.
Can you take us on a
Yeah,
quick
you bet.
little tour?
Come on inside. Come on, Archie. Let's go, bud. So these are the tiny houses. We have 49 tiny houses here at Veterans Community Project here in Kansas City. We also have campuses in Longmont, Colorado, which we've started construction on, and a campus in St. Louis, which we're about to begin construction on. 49 tiny houses. These are 240 square foot tiny houses. It's essentially like a studio apartment, but better. And what you see here is the way a tiny house is laid out when we move a veteran into it. Everything is brand new. They get their own pots, pans, dishes. They get their own linen. They always get a patriotic handmade quilt. We have organizations that donate these to us. Fully stocked bathroom. We stock a refrigerator, a freezer for their initial move in, and I mean it's all you need.
It's home. I love this.
It's all you need.
It is all you need.
Absolutely. And when a veteran transitions out of here, they get to take all of this with them to their new place. So this is transitional housing, 2 years or less. Anytime a veteran moves in, they're assigned a case manager, and that case manager helps them tackle their issues, basically. I tell people when I give them tours that people aren't homeless simply because they don't have a home. There's always something else going on in their life preventing them from being housed.
Matt, thank you so much for showing that. We're stay close because we want to come back to you. I'm going to let Archie go out and do some bird watching, and we're going to come back and talk to you in just a moment, and we're going to put some information up. Guys, in fact, for our viewers, if we can you go ahead and pull up the full screen so that people know I want to tell everyone about Vets with Pets. So this is an organization that is helping the Veterans Community Project, and the needs are right there on your screen. So dog collars, leashes, dog and cat treats. You heard they have all sorts of different animals there. So this is just if you love animals and you want to help our veterans, this is such an amazing way to help with that. And of course, you can drop off any type of items for these homeless veterans there at 8825 Troost. So we're going to put that back up on the screen again here in just a moment throughout the morning, so that if you want to do something impactful for a veteran today, this is a great way to do it. Barry, I want to talk with you just about veterans with PTSD. Is it does it differ, or was it similar with non-military people with PTSD? I mean, talk about that. And then I want to bring the COVID aspect into it and try to make some comparisons, if that's fair to do.
Sure. Yeah, I mean, veterans with PTSD and non-veterans with PTSD, they're really similar. The only thing that's really different is just the trigger that caused the PSD. There can be sleeplessness, isolation, anger. There can be a lot of things that affect civilians. I'll use civilians and veterans, which all it ends up affecting their family, their work, and all those kind of things. So it really is just the same.
Well, I think PTSD is a term that we immediately think of when we think of veterans. Right. We think of that, but now it's a term that we use to describe many catastrophic events in someone's life.
Frontline workers.
Yes.
I mean, all the things that we've gone through over the last almost 2 years, it seems like now, or getting close to it, affects everybody.
So is it fair to make that comparison?
I think so.
You do. Okay. So Dr. Yelinsky, tell me what you're hearing from veterans and how this pandemic has affected veterans that you know and that you've talked to, patients.
I think at the end of the day, veterans with PTSD, PTSD already is an isolating experience. And as a result of the COVID pandemic, some veterans may feel even more isolated and have more difficulties with reaching out to get help and assistance for their PTSD.
Well, you said an important thing as a physician. You said it's important for people. I think people or physicians, regular people like us, it's okay to ask somebody if they've served, what that was like for them. It's okay to ask about that. Can you help us understand what you mean by that?
Yeah, I think at the end of the day, most veterans welcome being asked the question, have you or a family member served in the military? And then that follow-on question of, what was that experience like? Tell me what it was like. I think for many years, veterans weren't asked that question, especially our Vietnam veterans. And then also, sometimes veterans get put up on a pedestal, and we want to come down and to say, yeah, let's talk about our experiences. Let's talk about what that was like. I'm
glad you say that, because you're right. I think Veterans Day is a day that we all take that day to pause, but you're living it every day. This is every day of the year for folks and the memories that they have, and it's okay to ask and talk about it anytime and have a better understanding about what you've gone through.
Yeah, absolutely.
Come down off the pedestal.
Well, and some of the treatments for PTSD is actually getting into the experiences. There's a lot of different ways to treat PTSD, but one of the biggest ways is making the person that's suffering PTSD relive the experiences, work through the experiences. Because as long as you just ignore it or encapsulate it and it doesn't exist, you never get past it.
Sure. How have veterans fared during this pandemic? I mean, just what you hear among your peers here at the health system, what do you hear?
Well, and I have a little bit of a different perspective. Yes, I work here, but I get all my health care through the VA. And so at the very beginning of the pandemic, it was really interesting that nothing was set up, just like here. We were all of a sudden trying to jump through and do telemedicine and all these things. Well, the VA, it took a while to get that all spun up. And so really everything just ground to a halt. If you had procedures you need to have done, or if you needed therapy or any of those kind of things, it stopped until the ball could get rolling again, which took 6 to 8 months or longer to really get that. And so anyone that was suffering from PTSD, they were missing out on their therapy, which was really key.
Not good. And so, yeah, just another one of those groups that is affected and,
Right.
and needs that medical help. So let's talk about the vaccine and hesitancy. I mean, the hesitancy comes in all forms, in all different groups. But what are your thoughts about the numbers we're seeing and maybe the questions they have? What makes that group unique as far as getting vaccinated?
Sure. I think for veterans, they've spent so many years in the military having a lack of choice and a lack of control. And I know most veterans have had so many vaccinations associated just with their military service. And then it becomes, well, I don't want to get one more vaccine, or I don't want to be told I have to get another vaccine. And also, there can be a mistrust of the medical system. Again, getting back to that lack of choice and lack of control associated with military service. And two, there's a lot of misinformation out there, especially about the vaccine. And at the end of the day, some people believe that the risks of the vaccine outweigh the benefits. And I think for me as a healthcare professional, I want to reassure our veterans that the benefits of the vaccine outweigh the risks. We also see veterans who have medical issues associated with their military service, whether that's lung disease associated with burn pit exposure, or cancers associated with depleted uranium exposure, or Agent Orange causing diabetes. And that population's at increased risk for complications from COVID. And I want them to know that, again, the benefits of the vaccine outweigh the risks.
Okay, so we want to get back there to Archie. He's sitting so still and being so good for us, Matt. We want to head back out to you. I want to ask you a couple more questions. Just specifically about pets there in the tiny homes. You said that the pets are allowed to stay with the veterans inside. Do you also help other veterans that aren't living there? Are they allowed to bring pets to your organization to receive help?
Well, yeah, you mentioned the outreach center, you mentioned leashes and your list that you put up on the screen there. So any veteran can come to the outreach center and get help. If they have pets, we have pet food. Archie's kind of done with being on the bed here, I think. But we have pet food, leashes, collars, toys, dog beds, things like that. So they can come and get any types of services like that. Sorry, he's 13 months old. He needs more attention than he gets sometime. We also provide for the residents in the village. We also have people that come out and do dog training on the weekends generally. So, and we have organizations that come and do wellness checks on the pets. Our community center, which is available for residents only, we have a dog wash area in there. So
that's that's great that you offer those services.
Pets are key. Thanks.
So, Matt, then you mentioned it a bit earlier, but just for folks who are joining us, just how important, though, are these pets to veterans? I mean, I know there's just a special bond, but help us understand that bond a little bit more and how important they are.
Sure. I mean, have you ever been let down by your pet? I mean,
Never.
That's the basic question. I mean, there you go. So they're loyal, they're faithful. They try to drink out of the toilet sometimes, but they're still your pets. And a lot of people that you see that are struggling, maybe it's because they've been let down by other people, or they've had some behavior that has caused that to happen. But generally with the pets, they're with you. I mean, they're with you for life. When you adopt a pet, I mean, it's like having a child. So. I got Archie as a companion. I got him almost a year ago, and I just wanted somebody that I could take with me wherever I went. He goes almost everywhere I go. He's not a service animal, so he doesn't get to go to the grocery store and a few other places, but he's just a great companion, something to have with me all the time.
Yeah, he's spoiled, I can tell. All right, tell him he's got to come
No.
No, tell him he's got to get his head out of the toilet here in a minute because I want to see him again. So while I have you here, though,
Archie.
Matt, I want you to tell me what you want our community to know about what you all need. What are your needs? Today is Veterans Day, and I know people are looking for an opportunity to help and to do their part. and to take that pause and show their appreciation. So what other needs? We know there are pet needs, but what about our veterans? What can we do? What could somebody drop off today or over the weekend?
Sure. Well, we're looking, it's the time of the year that we're looking for nice warm winter clothing, boots especially, like insulated coveralls, warm jackets, stocking caps, gloves, that type of thing. Matter of fact, we're handing a lot of that stuff out today at our stand down event up at the Outreach Center. Hey, buddy. Sorry, I'm making Cliff work here.
I know. That's all right. That's all right. He's happy to be out there. We love dogs. Okay, so hang tight. Let Archie run around, and we'll touch base with you here in just a few moments. Okay, Matt? Thank you so much. So I want to ask you, Barry, about the Veterans Resource Group through the health system. Tell us a little bit about that.
Yeah, the Veterans Resource Group really is designed and comprised of any employee of the health system that identifies with the military or being a veteran. We have close to over 500 members that have identified. We have reservists, National Guard that are active and that are still deploying, and then veterans such as myself and Dr. Ulinski.
Are there enough of these programs in our community? I think maybe if you're not a veteran, you don't know a veteran, you didn't grow up around veterans, you maybe think it's a group that's just being taken care of. But I'm glad we're talking about this today because we can find out what are the needs. Are there enough resources for our veterans in our community and beyond? Where's the hole that needs to be filled?
I as a veteran, I think Dr. Ulinski would say the same thing. We're biased. But with my experiences, I think we need more services. Veteran homelessness, which we've been talking about, is huge, and it's not just men, it's women also. And so there's a segment of the population that just gets forgotten. And so with the VRG, some of the things we do, like we support the Veterans Community Project. We help set up and supply their on-site medical clinic. We do things here inside the hospital. If a patient comes in and they've identified as being part of the military, we're there to assist the families and the veteran, no matter what they need. And we go up, we meet with them on the floor, in their rooms, talk with them, talk with the family, find out what their needs, if they have questions. Sometimes it's just sitting with them because they don't have any family, and it's just being there with them. And sometimes, their final trip out of here, after, they've gone, we give them a dignified walk out of the hospital. And so we do a lot of things.
What can you add to that?
I would say there are lots of organizations out there. What I think is most important is to make those links. So that's why it's so important to ask that question about military service so that we can identify our veterans and then make those connections, whether it's homelessness or whatever services they might need, whether they need to know about the services that are available through the VA, whether they need to know about any of the veteran service organizations like VFW or American Legion, all of those organizations. More often it's making those connections.
So you're saying don't miss an opportunity if you have a chance to be in front of somebody, certainly a healthcare provider setting here and any other spot here in our community, but anybody to be asking and to making sure that you're getting folks sent in the right direction.
And that's the thing that the VRG does. We get calls in all the time. And, asking for different things or, how do we, we had a veteran that had been hurt actually on active duty, was in the rehab, had lost the use of his legs. His family was like, what do we do? How do we, our house isn't even set up for this. And so we were able to get in touch with the different organizations in his community to get ramps built, to get things done. And it's because I'm an administrator. We have physicians, we have x-ray technicians, we have nursing, we have IT. We have a lot of people within the system with a lot of knowledge, and we're able to come together and get the things that we need for these veterans.
So Dr. Yedlinski, I'm going to pull up a picture, and I want you to help talk me through it a little bit, if you would, because your husband came back from his second tour could you tell me a little bit about, when you see this picture, what does that tell you and bring up?
So this was my husband's return from his second deployment. This was a rough time. He had a lot of traumatic experiences during that deployment, and that was sort of the beginning of our journey with PTSD. I echo Colonel Bono's how pets can be wonderful therapy, as well as the services that my husband was able to access through both the military medical system as well as through the VA to help get him through that very difficult time.
Because I see that big smile on his face, but that doesn't tell the whole story, is what you're telling me.
No, I look at that picture and I see he had lost a significant amount of weight. And that was a direct result of his traumatic experiences and him dealing with those experiences.
But he was able to access those resources. Do you guys have a dog in the house?
We have 2 dogs.
Okay.
And trust me, they are an integral part of his therapy for his PTSD, that unconditional love and acceptance, and just that calming influence that they have on him.
We want to get to some community questions today for our guests. Isaac wants to know, has a question for our guest. In your experience, and Matt, I'm going to come out to you here in just a moment and ask you this as well. But Barry, you tell me a question about, in your experience, are a lot of veterans reluctant to seek treatment for PTSD because they think it is an admission of weakness?
Yes. I mean, there's always been a stigma with asking for help, and especially in the military. Mm-hmm. You know, you'd never want to see or show you're weak. You want to, put the best face forward and that you're strong. And so asking for help, which if you have PTSD and going and getting help is one of those stigmas. And so it's tough. It's tough, but
are we getting better though?
I think we're getting better.
I think we're getting better. I do. Certainly also when you're still serving, if you have a medical condition or a PTSD diagnosis, that can affect your job, that can affect your employment. And so at the end of the day, I think that also contributes to reluctance to get treatment and to get help.
Matt, what are you hearing from your veteran friends there at the Village?
Yeah, I mean, I even when I was active duty, I agree with all the comments so far. Seeking help was a weakness. I think we've gotten better at that. I hope we have. We see veterans every day here in the Village in an outreach center that have experienced the same thing. Whether they never fully got diagnosed, went to get diagnosed, or whether it actually may have caused a discharge from the service for severe PTSD.
Dr. Hawkinson, I have a question for you. It's a media question from Donna at Channel 9. With an increase again in COVID cases, are the doctors worried we're heading in the wrong direction, especially as the weather cools and gatherings increase? I know you and Dr. Seitz have talked about your concerns about that. What can you add?
Yeah, I mean, we certainly always have those concerns. And again, it's not just about the cases. Certainly we know cases are not the only metric that we're using, because we know some people may not go get tested. Some people may be testing at home and those things aren't recorded. But we do know and understand that hospitalizations do lag behind the cases by a couple of weeks. And so that's really the concerning thing. If we do have that increased number of cases, then we have to expect that those hospitalizations will follow. And that's really what we are trying to protect people from, is going to the hospital, going to the ICU. And that's why the vaccinations are so important. It's not necessarily about the cases. It is about the hospitalizations, but we know we can use cases somewhat as a proxy for the impending hospitalizations that may come. So there is always that concern there, especially now as we are getting into colder weather. More people are going to be inside doing more things, probably lack of masking. So that's why it is so important for everybody who has not been vaccinated to go and start getting their vaccinations.
Okay, question from Jennifer. She says, I believe earlier this week in the news, there was an article that Pfizer had requested authorization for boosters to be available for anyone 18 and older. Can you discuss that, or do you have any new information about that?
Yeah, nothing other than it will be safe. We're pretty confident in that. Is it fully needed? We know that even people that got vaccinated in January or February of this year still have really, really good protection against hospitalizations, especially those younger demographics, those people that are younger than 65, we know you still have very good protection against that. Now, will getting that boost or that additional dosing help reduce transmission for some sort of short period of time? That may be a possibility as well. And so we'll just wait and see really what the data tells us, what the data shows. You know, we have relied on some other countries' data as well as our own, especially we've gotten very good data from the VA systems as well. And so they've contributed a lot to that, as Israel's experience as well. So we'll wait for that. Again, the safety is there. We know it will be safe. How much is it needed? There's also a concern that we shouldn't be getting these extra doses here in this country, but maybe giving them to other countries as well. Those countries that aren't as fortunate to have the supply that we do. But those are different aspects, not necessarily medical aspects. But again, we'll wait for the data on the medicine and really understand, is it needed? Will it help reduce transmission? But again, we know if you've got your first 2 doses of those mRNA vaccines, even back in January, February, you are still very well protected against going to the hospital.
Okay, a couple more questions for you, Dr. Hawkinson. Elizabeth says, I had COVID a month ago. I have a lot of headaches, dizziness, and my vision is blurry. Is this normal?
Yeah, this could be part of long COVID, and this is why we say, yeah, you may not go to the hospital. You may not die. You may not go to the ICU. But anytime you get this infection, you are rolling the dice with the complications that can occur. If you are vaccinated, we know we have good evidence and data signals to show that your risk of getting these types of post-acute or post-infection symptoms is lower, and that is one of the benefits of vaccine as well. So it certainly could be part of the long COVID. Again, for our long COVID multidisciplinary clinic, we really need you to have had the acute infection and then those symptoms for 12 weeks prior to getting in. But if those symptoms persist, hopefully they will go away and you'll get back to your normal daily routine. But if they persist, certainly we are willing to see you and evaluate you for those symptoms and try to provide some of that support and help towards getting better.
And Angela would like to know, how would I know if my child gets myocarditis? What are the signs?
Yeah, and I'll have Dr. Yedlinski step in here as well. But I think for the most part, you're going to really just be identifying with maybe some symptoms that child may have, such as chest pain, maybe some shortness of breath. Those are really going to be the main things, and I'll let Dr. Yedlinski answer that too.
Yeah. So some of the symptoms associated with myocarditis would be like what Dr. Hawkinson said, chest pain. Sometimes you can experience a rapid heartbeat. Sometimes patients might experience a little bit of shortness of breath or some exercise intolerance. And we can see myocarditis. There were some cases in the adolescent male population after vaccination, as well as we know that there's a risk of myocarditis after COVID infection itself.
Yeah, and that's a great point. I would like to piggyback on that. You know, we still have some parents saying, well, why do I need to get my kids the vaccine if they are going to be at risk of myocarditis? But that risk of getting myocarditis is much greater if you get the infection compared to if you get the vaccine. In addition, we know that the median number of days in the hospital, if you have myocarditis from the infection itself, is 6 days, almost a week. But we know that the median stay in the hospital, if you get myocarditis from the vaccine, is only a day. So, you know, you are certainly going to be in the hospital longer getting myocarditis from the infection itself as compared to the vaccine. And what we have seen is the vaccine-induced complications really are very self-limiting and last just a short amount of time.
Back to our veterans, Dr. Yedlinski, what do you want them to know about COVID and the vaccine as we wrap up this morning? Just what's important, what's a good message you really want to send to them this morning?
Again, getting back to that idea that there's so much misinformation out there, and I want our veterans to know that the benefits of getting vaccinated far outweigh the risks from the vaccine itself. And if you have questions, please reach out to a reputable healthcare professional to answer those questions directly.
What would you say to somebody who has some doubts or some hesitancy? What message do you want them to hear from you directly?
Well, I would say it as a veteran and having, you know, as we talked earlier, having multiple vaccinations. I've had 14 anthrax shots over my career in the military. And so, that was very interesting to say the least. But with the COVID vaccine, it's been tested, it's trusted. We have the track record on it. As Dr. Hawkinson was saying, it's better to do it and maybe have some milder effects if you do get COVID than to not have the vaccine and have very severe long-term consequences of it. And so I would say if I can do it after 14 anthrax shots, anyone can do it.
You could do it. Yeah, it's the same message we say every day. So thank you for reiterating that. Quick question though, Emily wants to know, does the vaccine protection drop for teens after 6 months also, specifically 13 to 15? Do we hear anything about that?
Yeah, I don't remember specifically off the top of my head. I think we still have good protection after that 6 month time point for those adolescents as well. So again, I think we have to talk about what are we talking about with vaccine protection and effectiveness. Is it protecting against the infection itself, which the vaccine is really not made to do that, but it does provide that protection, especially in the short term. More, are we talking about protection against going to the hospital? Certainly it does continue to provide that protection even after that 6 month mark.
Anything to add to that?
I just want to add, we also have to look at the risk to other individuals who may come into contact with those adolescents, right? So not only are we protecting our adolescents in that 13 to 15 age group, but we're also protecting all of the folks who may come into contact with those adolescents as well.
All right, everyone, we have been live this morning from Veterans Community Project. We are live inside with little Archie, one of the pets that is allowed to be there with the veterans, live there at the tiny house village. They are inside one of those tiny homes. And like Colonel Matt Bono said, it's really all you need. And so it's been really thrilling to be live with you this morning. Matt, just what would your final message be to folks just about as we take a moment to pause on this Veterans Day? What do you want everyone to know?
Yeah, I think veterans are built for service. We took an oath to protect and defend the Constitution of the United States, and I think part of veteran health is staying engaged with something that you're passionate about. And so I would encourage people, find something that you're passionate about. This is something I'm passionate about. And serve those organizations. It helps other people, helps your fellow vets, and really makes for a good life.
Hey, Matt, I don't want to make Archie get up, but would he jump up and take us outside so that we could just take one quick look at your village? I just think it's so neat and special, and it's such a beautiful day. Can you guys take us outside real quick and just show us around real fast?
Yeah, you bet. Come on, buddy. It's an awful tall bed, so I'll put him down.
Okay.
Let's get you
Come on, buddy.
Ready to go, bud? He's happy to go outside because there's birds.
I know. I love it. How many houses out there?
So this is so we have 49 tiny houses here. 45 of them are this size, so they're the 240 square foot houses. And then we have 4 family size houses, which are 320 square foot. So just a little bit bigger. They've got a bunk system and a queen bed so they can fit a family of 5.
Well, it's a beautiful space, a beautiful neighborhood made for those veterans. So we appreciate you showing us around today. Archie, thank you for getting up. We appreciate that. Matt, thank you so much for your service, most importantly. And please give our best to all of your community members out there today. And we're going to put some information now up on the screen so that if anybody wants to reach out, donate to the Veterans Community Project, you can do it right there. You can go to 8825 Troost and drop off any needs that the homeless veterans have. Also needs for their animals. If you're an animal lover, Vets with Pets is holding a drive through Monday, but you can drop those off really anytime and they will appreciate it. So thank you both for joining us this morning. Dr. Yadlinski, your final thoughts.
Yeah, I just want to echo what Colonel Bono said, which is find what you're passionate about, especially when it comes to helping out our veterans, whether that be something like the Veterans Community Project. I'm involved with an organization called Band of Runners, which brings trail running to our veterans, especially those with PTSD, and to our Gold Star families, and just see what you can do to help out.
Barry, your final thoughts today.
Well, I just say if you're a veteran or not a veteran, if you are struggling right now during this time, reach out and get help. It's not, there's so many resources out there, which we talked about. You just got to go to the right place. And I would even say, I'd say start with your primary care provider. They can help direct you. There's counselors, there's psychologists, there's all sorts of people out there that can help. Just ask for help, and people will be willing and help and get you where you need to be.
And I like hearing that we've kind of advanced the ball forward even a little bit with people kind of pulling that stigma away from getting help and reaching out. So
100%.
Good to know.
Just ask.
Just ask for help. And one of our viewers, Dr. Jedlinski, says, Happy Veterans Day to you. She is a strong advocate for the health and safety of our children in our community.
Thank you.
You're welcome. Okay, thank you both for your service. Dr. Hawkinson, your final
Yeah,
thoughts today.
Certainly, thank you to our veterans. Thank you for protecting us, protecting our democracy. My grandpas were serving in World War II in the Pacific and in Italy, so thank all the veterans through time that have helped this great country. Also, continue to get vaccinated, and certainly Dr. Jedlinski knows and understands this. I just saw a story right now. 22 million infants missed their measles vaccine in 2020. We have gotten these childhood preventable diseases under control because of vaccination. It is so important to get your children to their physician's appointments to get those vaccines to help protect them and protect the people around them as well. And so we know that they work, we know that they're safe. Please continue to get your children vaccinated, get yourself vaccinated, and really protect yourself and the rest of your bubble, really.
Thanks for all of our guests today, and thank you all for joining us. And please continue to send in your photos of your kids and your grandkids. We love showing how they are leading the way, they're being brave, and they're taking their shots. So please send those in, and we will show them right here on our show. And please join us on Facebook, Messenger, and also you can send those in on Medical News Network. We'll show those again at the end of the program. Thanks for being with us. Coming up tomorrow, it is Follow-Up Friday, as always. So we're going to get to some of those questions that we did not get to earlier in the week. We're also going to hear from one expert who advises schools on kids masking and COVID. We know parents have many questions on what to do now that their kid is vaccinated, but other kids are not. And this all comes while the masking mandates are starting to be lifted in many districts. So we'll talk more about that tomorrow. Have a great Thursday. Happy Veterans Day. We'll see you at 8 a.m. tomorrow.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.